Welcome everybody to Canine Addison's Resources and Education interview and webinar with Canine Addison's researcher, Dr. Stephen Friedenberg. And as you know, we are going to ask Dr. Friedenberg to tell us about Addison's and also to update us on his research. And so what we will do, if I change my slide here, I am Lori Basher. I am one of the co-founders and president of CARE. We call it CARE for short. CARE is a nonprofit organization that we founded in 2013. We provide resources and education to improve the lives of dogs with Addison's and empower people to advocate on their behalf. We also have a Facebook group with currently 6,600 members and growing. We do many things outside of Facebook, inside and outside of Facebook. So we have a website with many educational documents, as you know. Our documents are translated into many, many languages by our volunteers who are very gracious with their time. And many of them are here with us today, so thank you for that. We have Addison's brochures that are also translated into many languages, distributed in many countries throughout the world. We have surveys that we do about treatment. We do CARE community social events on Zoom. We get together and we meet each other. We've done CARE classes usually for new people who are new to Addison's. We have an international board of directors. So we have many countries represented. We do not have all of our board members here today, but we do have a couple others besides myself. And with that, I'll ask Mary to introduce herself briefly.
Hi, I'm Mary Speakerman. I've been on the CARE board, I think, since 2016. I'm the treasurer, and I also usually head up Addison's Awareness Week. For those of you unfamiliar, we take a week in February that we dedicate to awareness and educating people outside of our group as well as inside our group about Addison's. And COVID's kind of changed things a little bit with it, but we try to get brochures out there, as Lori mentioned, our brochures, and just do many different little things throughout the course of the week to raise awareness.
Okay, thank you. And I think we have Sue with us as well. Sue Davies, are you there?
I am now. Yeah, I'm Sue Davies. I'm from South Wales in the UK, and I think I'm the baby of the board. I haven't been with them that long, but thoroughly enjoy being with them. I think my role on CARE is mainly with the welcomes of new people with their dogs, which is very enjoyable. Yeah, I don't have an Addison's dog of my own at the moment. He's passed away, sadly. But yet, who knows what the future will bring.
Thank you, Sue. And I can't see all the participants, but I think that's all the board members we have with us. We do have some past board members. And if there were time, I would ask everyone to introduce themselves, but there's not time. So with that, I'm going to ask Dr. Friedenberg to tell us about his background, including what you study and what makes you interested in those diseases.
Yeah. Great. Well, thanks so much, Lori, and thanks for putting this all together this afternoon. I guess I just want to start off, even before I give you guys a little bit of information about my background, just to first thank everyone, not only for coming, but for everyone who's part of the CARE group in terms of, you know, we sort of post constantly about research projects that we have going on. I know many of you guys have contributed, not only with your own dog's blood or serum or just filling out surveys or things like that. And, you know, we really couldn't reach the audience that we reach without you guys. So thank you, Lori. Thanks to everyone on the board. Thanks to everyone who has participated in research. We really, really appreciate it. And, you know, I think you guys serve a valuable research resource, not only about as a researcher, but also for the whole Canine Addison community. So thank you. So kind of with all of that said, I will tell you a little bit about myself. So I am a criticalist, like was from training. So I'm a vet. I went to vet school at Cornell. I graduated in 2009. And then I went after vet school, I went and became a criticalist, which is where we take care of patients in the emergency room and ICU. And I had always been really interested in genetics and had thought after I finished my residency that I wanted to go on and do a PhD. And I was really interested in diseases that are kind of at the intersection of both critical care medicine and genetics. And people had sort of looked at Addison's disease very, very cursorily, like very, very high level stuff to look at the genetics of Addison's disease. And I really wanted to kind of devote my time to Addison's disease because I felt like it was a great disease to study, especially given how common it is in certain breeds. These are patients that I see regularly from a clinical perspective, particularly in the emergency room or sometimes in the intensive care unit. So it was really really a strong interest for me, and I'm sort of happy to have been studying it. I've worked on Addison's disease primarily in standard poodles for my PhD, but have since branched out and doing much more work these days in Portuguese water dogs, also Cocker Spaniels, and then, in the community a little bit more broadly, looking at some environmental exposures, and we'll talk about that as we work through it. So that's a little bit about me. Currently, just FYI, currently I'm a faculty member at the University of Minnesota. I've been at Minnesota for about 5 years now. I have a lab that has about 4 grad students, and almost everyone is focused in one way or another on something related to Addison's disease. And I also, in addition to myself, I have collaborators across the world who I work with on the disease as well. So thank you. Yeah, that's a bit about me.
Wonderful. Thank you so much. And we appreciate that you're interested in Addison's and that you have dedicated your work to it.
Yeah, absolutely.
It's not a disease that a lot of researchers are looking at, and we really appreciate that you are. We are very passionate about the disease, obviously. I'm going to let people know what we're going to talk about. I'll also let you know what we're not going to talk about. So today's session will not be about low-dose DOCP or treatment, ongoing treatment. We are planning a session about that, but that is not this one. What we want to do is have Dr. Friedenberg share his expertise on these things that I'm about to share my screen and show you. So, pathophysiology of canine Addison's disease. Clinical presentation and treatment of an Addisonian crisis, research-focused findings and ongoing studies, and participant questions. So I will introduce each of those sections as we go. I'm going to take this down because I would rather see Dr. Friedenberg than my slideshow. Okay, so Dr. Friedenberg, and I'm used to calling you Steve. I'm going to try and address you formally.
You can call me Steve. Like,
Okay.
I rarely go by Dr. Friedenberg. So
Okay.
You can call me Steve. Everyone can call me Steve. Yeah.
Okay. So we have a couple of challenges today in the session. One is that we have about 10 hours worth of topics and questions.
Sure.
That we're going to fit into an hour and 15 minutes. We have a hard stop at an hour and 15 minutes. I would say the time, but it's different for all of us. So the other challenge is that we have a wide audience. So we have some veterinarians here.
Yep.
We have some breeders here. We have many people, but not everybody, who has a dog with Addison's. Some of these people have been in the Addison's world for decades, and some are brand new. So we will try to cater to all of you as best we can in our session today. So to get started, we're going to start with pathophysiology.
Sure.
So Steve, can you tell us a bit about Addison's, what it is, including the pathophysiology?
Yeah, for sure. And so Addison's disease is a disease of the adrenal gland. And if you want, Lori, maybe this may be a good time to sort of just walk through some slides as I'm going through it. So I'm going to share my screen. I'm going to share my screen at this point. Let me see if I can find the right one. Okay, it should be this one. Okay, sorry, I'm just at the wrong slide here. Okay, great. So we'll talk a little bit about, and did this show up as full screen now for you guys? Can you see just says pathophysiology of Addison's disease?
I can see that and I can see you, which is great.
Oh, perfect. Okay, great. So yeah, so when I think about the pathophysiology of Addison's disease, you know, I think the first thing, and I apologize if this is pretty basic for everyone, but Addison's disease is a disease of this gland called the adrenal gland. And so I think it's important to understand a little bit about the adrenal glands and where they live and what they look like, because that helps us understand a little bit more about the disease. And so your adrenal glands are these glands that in you and me live just on top of the kidney. You can see there's a little bit different shape on the left and on the right. It's a little bit more triangular here on the left, and it's a little bit more rounded on the right. But there are these glands that live on top of the kidneys. They're not part of the kidneys. They're sort of a separate organ of the endocrine system. And if you're a dog, which is what we're here to sort of think about and talk about today, you would just kind of tilt those kidneys 90 degrees, because dogs were sort of humans in some ways, but rotated 90 degrees forward. So in dogs, the adrenal glands are these glands that live just in front of the kidneys, is how we think of them. And a lot of times I just sort of throw this slide up here. We sort of when we look at the adrenal glands, we look at them via ultrasound. And via ultrasound, they look like this little peanut-shaped organ, this sort of thing that you can see here outlined in black. It's just encased in fat here a little bit. And one of the things that you can kind of make out when you look at the adrenal gland, even from this picture, I don't know if you can kind of make out that there's this sort of outer aspect of the adrenal gland, and there's this also inner darker aspect of the adrenal gland that's kind of demarcated by this white line here. And that actually separates two different important parts of the adrenal gland, but fundamentally, just to kind of keep in mind that this is a disease of the adrenal glands, and that's really what we're talking about here. And I think to understand the pathophysiology of Addison's disease, you have to understand a little bit about the architecture of the adrenal gland and what goes on, and sort of the different hormones and things like that that are made by the adrenal gland. So if you remember, and Lori, feel free to interrupt me if I'm just kind of babbling on and you think people have additional questions, but I mentioned in the previous slide that there are actually these two parts of the adrenal gland. And the two parts of the adrenal gland, there's this outer part of the adrenal gland, which is labeled here the adrenal cortex. And then there's this inner part of the adrenal gland called the adrenal medulla. And when you sort of think about like way we all develop as like embryos, the adrenal cortex and the adrenal medulla are like two entirely separate organs, even though they're part of the adrenal gland. And the best way to think about the adrenal medulla is you're probably all familiar with like the fight or flight response and adrenaline and things like that. So the adrenal medulla is really more part of the nervous system, and it secretes adrenaline as part of the fight or flight response. And it has absolutely nothing to do with Addison's disease. So when we think about Addison's disease is not only not a disease of the adrenal gland, but it's really a disease of this outer portion of the adrenal gland, which is called the adrenal cortex. So if you have Addison's disease, your fight or flight response, all of that sort of works perfectly normally. And what happens in Addison's disease is that this adrenal cortex gets attacked by the body of the dog or the person who has Addison's disease. So the immune system wakes up someday, we don't really know why this happens, no one knows why this happens in either dogs or people, and says, hey, I'm gonna start to destroy my own adrenal cortex. And that's kind of bad, right? Because the adrenal cortex does a lot of things for the normal body, including making hormones. That's really its role. And these hormones are really, really important just for the life of the dog or the life of the person that has Addison's disease. One way that I sometimes like to explain to people what Addison's disease is many of us here have dogs with Addison's disease or know dogs that have Addison's disease, but even more people will be familiar with people who have something like type 1 diabetes, right? So type 1 diabetes is an autoimmune disease where the body attacks its own pancreas. And the Addison's disease is very much the same thing. It's an autoimmune disease where the body attacks another endocrine gland. And in this case, that gland turns out to be the adrenal cortex. And I had mentioned to you guys that what this is an autoimmune disease, and how do we know that this is an autoimmune disease? Well, there's a number of different reasons we know it's an autoimmune disease, but the number one reason we know is because when you look at diseased tissue, so you look at the adrenal cortex in a dog or a person, this is actually from a dog that has Addison's disease, you can kind of see all of these like blue dots that are congregated in this area here. And those blue dots shouldn't be there. They're immune system cells that are actually going in and attacking the adrenal gland of this dog who wound up dying of Addison's disease. And so that, plus a number of reasons, is the reason why we know Addison's disease is caused by this immune-mediated destruction of the adrenal cortex. And going back to this previous slide, if you were to look at this previous slide here, if you were to look at a lot of dogs that have like essentially end-stage Addison's disease, or which is really where most dogs present, this entire adrenal cortex, which is normal in this dog, would just be replaced by fat tissue. It's essentially obliterated. And so therefore the adrenal cortex, then the adrenal gland can't produce these hormones that are really, really important for life. So hopefully that makes sense a little bit, Lori, as far as the basic pathophysiology of the disease.
It does. Wonder if you can tell us a little bit about what cortisol and aldosterone do for the body, and what happens if the dog can no longer produce them.
Yeah, absolutely. So let me kind of go on and we'll talk a little bit more about the adrenal cortex and the hormones and how all that works. So if you were to sort of take this adrenal cortex, remember Addison's disease is just a disease of this outer layer of the adrenal gland, and you're a pathologist, right? So you're a scientist, you just nothing but look at the types of cells. One of the things that you can start to see, and you can even like put on your own imaginoscope in this image here, there's actually 3 different types of cells in this adrenal gland. Like, I don't know if you guys can see my cursor, but there's this kind of layers, these cells here that looks awfully white. And that's because they're filled with fat, or basically hormones that they're making. There's this kind of purplish layer here in the middle, and then there's this pinkish layer here. And so the adrenal cortex itself is made up of 3 different types of cells. When we sort of talk about them, and we call this the zone of glomerulosa, fasciculata, and reticularis. These names are not really important, but each of these different zones makes different types of hormones that are really, really important to the body. And I'm going to kind of fast forward and sort of show this other slide here that breaks it down just a little bit further. So here you have, again, just taking from the top, this is a cross section of an adrenal gland. We have this inner layer, the medulla, not relevant for Addison's disease. And then we have this outer layer, which is called the cortex. If we double click or zoom in on the cortex, you can kind of see that there are these 3 different layers. We have this kind of fatty layer, this purple layer, and then this pink, here's the purple layer, the pink layer, and this sort of outer fatty layer right here. And what's interesting about all of these different layers is these different layers actually produce hormones that are really, really important in the normal functioning of the body. And this outer layer, the zona glomerulosa, produces this hormone called aldosterone. And this middle layer, the zona fascicularita, produces these hormones called cortisol, right? It is primarily what's produced in the middle layer. The inner layer, the zona reticularis, produces some other androgens that are important in the body, more important if you're a human than if you're a castrated or spayed animal. But so they don't really have too much of a clinical relevance for our canine patients. But it's really these hormones that are produced by the outer layer of the adrenal gland that are essentially destroyed and no longer produced in dogs with Addison's disease. And Laura, your question was specifically around what do these hormones do? And I'm going to sort of talk a little bit about that right now. So cortisol is one of these hormones that I like to think of it when I talk about cortisol, it's like the stress hormone in the body. So all of us in our lives, in a dog's life, undergo stress. That could be from having to like work late. If you're a dog's perspective, you're going to a new home, or you're going to the vet, or you're getting kenneled somewhere. And so in response to these stressful situations, we have this hormone called cortisol that gets released from that outer layer of the adrenal gland. And it has a number of different effects, right? So it does things like it tells the liver to make more glucose, which is blood sugar. Insulin, which is a hormone that tells sugar to go into our cells, cortisol counteracts that effect. It also has anti-inflammatory effects on the body. It helps regulate the tone of blood vessels. It has effects on acid secretion, fat metabolism. So kind of a wide range of effects throughout the body. And so, but again, cortisol is really, really important that this hormone gets secreted in times of stress. And when it's not secreted in times of stress, that helps contribute to what we see in our Addisonian patients. Aldosterone, which is the other hormone that you had asked about, Lori, that is also really, really important in Addison's disease. So aldosterone actually has its primary effects, or the most effects that we care about, in the kidney. So aldosterone gets secreted from the adrenal gland. This is just sort of a cartoon that shows you what happened, where this is a blood vessel here on the right. And you can see I've just made a cartoon where aldosterone are these green dots, okay? And so aldosterone goes from the adrenal gland, it gets into the bloodstream, and then it goes into the kidney, where there's this type of cell in the kidney. The name of that cell is called a principal cell. And it's really irrelevant for the purposes of this discussion, but it binds to a receptor in these cells. It goes into the inside of the cell, and it tells the cell to actually put these channels, one is for sodium and one is for potassium, into these cells of the kidney. And when these channels get put into these cells, what happens is these channels normally tell sodium to get taken up by the kidney, so you reabsorb sodium, and to get rid of potassium. So that's what normally happens with aldosterone, is it tells the body to get rid of potassium and to take up sodium. So you can imagine in a patient with Addison's disease, where you're not having aldosterone, you have these opposite effects, where you get, instead of high sodium and low potassium, you get low sodium and high potassium, and that causes all sorts of bad effects for the body, particularly the potassium, which when it gets really high can actually stop the heart. So that's something that we as criticalists, as veterinarians, as physicians, all worry about a ton when that potassium gets so high.
That's great. Thank you so much. What I will say is that I have a number of follow-up questions. I'm going to hold them until the end if there's time.
Yeah, for sure.
So,
if any that are super relevant, feel free to ask them now, but whatever works for you. Yeah.
Right. I'm just very conscious of the time. So, and for those who are listening, if we're going too fast, you can always, take notes and ask questions in the CARE Facebook group. We will discuss this as deeply as you would like to. Dr. Friedenberg is not going to be there with us to answer these questions, but I've talked to him a lot and understand a lot of this. So let's move on to the next section, which would be clinical presentation and treatment of an Addisonian crisis.
Yeah.
If you can tell us about that.
Absolutely, yeah. So I'll sort of like fast forward and we can look at some of these sort of slides here. I'm just going to sort of skip through some of these things. So, the typical clinical presentation, right? Let me just find the right slide here. So, there's two different ways that I think dogs tend to present with Addison's disease. So the literature would say like about a third of dogs, maybe a third to a half of dogs, present with what we call as an Addisonian crisis. And typically this happens because, it's not recognized, or the clinical signs just kind of come on really fast. And when dogs present in an Addisonian crisis, they'll typically have vomiting, diarrhea, they'll be really lethargic, flat out, not want to eat. They'll have lost a lot of volume from their bloodstream and from the diarrhea and from the vomiting. And these patients present in a really, really bad state. They often present to the emergency room. They have significant electrolyte abnormalities, and they're really at imminent risk of death when these patients come in. We sort of skipped this topic, and I'm sure we'll come back to it in a second, but Addisonian crisis is typically happen in dogs that have what we call typical Addison's disease. The other way which dogs can present, and this is sort of regardless of whether it's typical or atypical Addison's disease, is they can present with these like routine signs, and sometimes they're really vague, right? So Addison's in human medicine is known as like the great pretender, because it can mimic so many other diseases, And kind of the most common things that we see in our canine patients are just vomiting and diarrhea, or they have this, hey, sometimes they want to eat, sometimes they don't want to eat. Maybe my dog is a little picky. It sort of comes and goes, right? Someday you'll have diarrhea, some days you won't have diarrhea. And it's just kind of these vague clinical signs. And sometimes these vague clinical signs will prompt veterinarians to do blood work. Some blood work, if it's a typical Addisonian dog, will sort of show up right away, right? That this is a typical Addisonian dog, because in typical Addison's disease, you have electrolyte abnormalities. But there's another form of Addison's disease, which you call atypical, and that won't show up on routine blood work, but it's something that a lot of veterinarians will look for when patients have these kind of routine clinical, these sort of vague, clinical signs.
Actually, I think maybe I saw you go past.
Yeah, I did. Yeah.
What happens when a dog can produce aldosterone and cortisol? And I wonder if that also is part of the clinical presentation.
Yeah, for sure. Yeah. So when a dog can't produce, I'll go back and
that's fine. You can just go ahead and
you'd want me to, right? So, when we don't have these hormones, right, what do we actually see in our patients? And some of these effects that we typically see in patients with Addison's disease, some of these are mediated by the loss of aldosterone, right, which is one of the hormones that we talked about. And some of these effects are mediated by the lack of cortisol. And so typically what we'll see patients present with a low sodium and a high potassium. And that's because the kidneys can't do their job of retaining sodium and getting rid of potassium. We'll also see patients have really low blood sugar. And that's because one of the things that cortisol does is it counteracts the effects of insulin. And it's also important for liver function. Without that aldosterone, if you can't reabsorb sodium, you actually lose a lot of fluids into the kidneys. You're having vomiting and you're having diarrhea. Some of that is due to the cortisol. So you get a lot of fluid loss and dehydration. You see changes to your blood pH, which is sort of how acid or base your blood is. And that has really important implications for the ability of your enzymes in your body to work well. You'll have difficulty in maintaining your blood vessels. So patients with an Addisonian crisis often present in like a shock state. And then we can see other markers that indicate an absence of a stress response on some of the routine blood work we see. So these are typically the effects that we see from lack of aldosterone and lack of cortisol.
Great. I think what makes sense is for me to let you go through your slides, because you and I talked about the topics we wanted to cover, and just be cognizant of, I want to save as much time as possible for research.
Okay, yeah, for sure. Yeah, so I think the things that I really wanted to cover a little bit more with you guys on the clinical presentation. I talked earlier about, Lori had asked how dogs present, and I sort of mentioned there's a crisis presentation and there's a routine presentation. To some extent, whether a dog presents in a crisis mode versus a routine mode depends upon like which type of Addison's disease they have. And there's a number of different ways of determining which type of the way of sort of saying what type a dog has. I think the most common way, and I think the most relevant way for the vast majority of people, is to think about dogs that have typical versus atypical disease. And so what do we mean by typical Addison's disease? So fundamentally, you might remember I told you guys that there's two hormones, there's cortisol and aldosterone. In typical Addison's, which is really what we see in probably about 80 or 90% of cases, dogs will not produce either the glucocorticoids, which are cortisol, or the mineralocorticoids, which are aldosterone. And because you don't have that, you're not able to make aldosterone, veterinarians can see these changes on the sodium and potassium levels on routine blood work. So it's the kind of thing that if dogs present in crisis mode, an emergency care clinic is going to look at electrolytes. Many veterinarians will run routine blood work, like a chemistry profile, just as a routine screening of animals' health. They could also see these sodium potassium changes, even if a dog's not presenting in a crisis mode. Because dogs don't have aldosterone in typical Addison's disease, they tend to become more dehydrated, have much more fluid loss, in particular through the kidneys, so they have a much more severe clinical presentation. And then when you treat typical Addison's disease, you need to treat a dog with multiple hormones. And so for those of you guys who have dogs with Addison's disease, you probably know that you give your dog an injection of percortin or Zycortol once a month, and then you also have them on some dose of steroids. So those are the multiple hormones that they require treatment with. In the atypical cases, this is where you have an absence of cortisol only. And it's a little unclear what's going on in terms of the pathophysiology of typical versus atypical Addison's disease. Sometimes, as I wrote at the bottom, patients can start out being atypical and progress to typical, but atypical Addison's disease can be a little bit harder to diagnose on routine blood work, and that's because it will not result in changes to the sodium and potassium levels, and the clinical presentation of sort of this waxing and waning, vomiting, diarrhea, appetite tends to be a lot more vague and can resemble a lot of other conditions. So, you know, that's why it is less common, but it's also hard to diagnose. And you have to be working with a veterinarian who has an eye out for thinking, hey, could this be an atypical Addison's case? And then run a different test to see if it's in fact Addison's, atypical Addison's. Does that make sense?
It does. And we have a few dogs who have secondary Addison. So if you can just.
Yeah, so secondary Addison's, and like this had sort of come up, is actually really rare. And so I don't always like to sort of bring up the secondary Addison's thing, because you rarely see it. It is almost always the kind of thing that, you know, is going to get diagnosed by an internal medicine specialist who's kind of thinking about these things. But the way that I sort of think about primary versus secondary, and let me try to just advance this slide here. So I'm going to you can sort of see, this is a cross section of a dog's brain. And here you have, or a human's brain actually, and here you see an adrenal gland here. So what's the difference between primary and secondary? So in primary Addison's disease, which is far, far, far and away the most common type of Addison's disease that we see, the body is attacking its own adrenal gland, right? So the problem lies within the adrenal gland. There's this other gland in the brain, right? And that's called the hypothalamus. And within the hypothalamus, there's this gland called the pituitary gland. And the pituitary gland secretes other hormones that actually have these direct effects on the adrenal gland itself. And in secondary Addison's disease, the problem doesn't lie with the adrenal gland itself. The problem actually lies with this pituitary gland, and the pituitary gland not doing its job of telling the adrenal gland kind of what to do. And so it's really rare that we see these cases. You know, they require a much different kind of workup, and they really tend to present more like the atypical Addisonian cases because they don't have much of an effect on the aldosterone. So you won't see these sodium potassium changes in the vast majority of secondary Addison's cases. So hopefully that makes sense. Primary, think of problem with the adrenal gland. Secondary, think is a problem with the pituitary gland causing the vast majority of these issues. Okay.
That makes a lot of sense. Thanks for covering that.
Right, for sure.
And I'm just going to let you go on.
Yeah, so I'm trying to remember, primary adrenal, secondary pituitary. So it was like, that was what I sort of popped up here. Yeah, so in terms of clinical presentation, I've sort of covered this, right? That dogs present typically in either an Addisonian crisis, or they present with this routine presentation. And I think, again, this Addisonian crisis is only going to be for the typical cases, but the routine presentation, all of the atypical cases will present as routine, but sometimes the typical presentations can present as routine cases as well. It just really depends upon how far along the disease is progressed in a particular dog. And I think that's really all I had to say about the clinical presentation. I can talk a little bit about the diagnostics if that works for you, Lori. Yes.
Sure. If you want to take a couple minutes.
Any other relevant questions about the clinical presentation that I missed?
No. The one thing I'll ask you to cover at some point is what is the life expectancy for dogs with Addison's after diagnosis?
I'll just cover that now, right? So, you know, there's actually a good paper, and I think there's really there's relatively good evidence that dogs with Addison's disease can live the same lifespan that dogs without Addison's disease can live. So there's no difference in that. What it is going to be is it's going to be a more expensive lifespan on the course of the owner, right? And I think that's because particularly for the typical cases that require the injections of Zycortol or Percortin, that's usually how these guys are treated, that can be expensive. And, like one of the breeds that we do see Addison's disease in regularly, for example, is Great Danes. Dosing Percortin and Zycortol is something that's, regardless of whether you're doing low dose or not low dose, it's a weight dependent kind of thing. So, the Great Dane is going to be a lot more expensive to maintain. And, I think when I talk to people about it, I think it oftentimes comes to around $200, $250 a month, because not only is it the drugs, but there's testing that needs to be done to make sure that the electrolytes stay at a normal level, particularly when you're, getting things equilibrated in the beginning. It's possible dogs will have an Addisonian crisis in their lifetime, and that can be additional veterinary expense as well. So the life expectancy, the same when you look at it statistically. The cost can definitely be more expensive, as I'm sure many of you guys are aware of.
Right, and I will take this opportunity to mention in passing that one of the things we do in care is to help people help make costs more manageable. So teaching people ways that it can be manageable from a cost perspective.
Totally, yeah. And so for example, one thing that a lot of owners will learn to do, and maybe this is one of those things you're mentioning, or it's like to learn to give the injections themselves at home, right? Because that can certainly save you from going to the vet as often, et cetera. So yeah, that's just
right.
Okay, great. So I wanted to talk a little bit about testing for Addison's disease. I think this is something that most of you guys are pretty familiar with, especially if you have dogs with Addison's disease. So the way that we think about it as veterinarians is the first test that we're going to do. So there's the first thing I would sort of say is we look at electrolytes, right? And if the electrolytes are wonky, right, there's a really low sodium and there's a really high potassium, our index of suspicion for Addison's disease is going to be there, right? And it might be higher, or it might be lower, depending upon the clinical presentation and the breed. There are certainly other diseases that we see in veterinary medicine that can cause low sodium and high potassium. So Addison's isn't the only thing. But what we're going to do if we see those electrolyte changes, or if we're concerned that this is an atypical dog that won't have those changes, we start out by doing what we call a screening test, which is a baseline cortisol test. This is a test that some veterinarians can do right in the office, which is called a SNAP test, or it can be sent out to a reference laboratory. And if the baseline cortisol is above 2, that rules out Addison's disease. So you can't diagnose Addison's disease based upon a screening test, but you can rule it out. And the way you rule out if it's above 2, and for all the people here who are in Europe, they don't measure it in micrograms per deciliter. It's measured in I think it's like nanograms per something else. And I think the cutoff is 55, but I just don't remember off the top of my head. But if that, so I apologize for my, American style units here to everyone calling in from overseas.
That's okay. There's actually a converter online that I use.
Yes. Yeah.
Because we're an international group.
Right.
So I know it has to be under 2. I think the other one is we see a lot is nmol per L.
Yes, nanomoles per something per.
Yeah, I'm glad it's difficult for you as well.
And I think that is 55, but anyway, don't quote me on that. But
Yeah.
anyway, so if it's less than 2, then that means the test is equivocal. So we can't say, does your dog have Addison's disease or does your dog not have Addison's disease? And one question that sort of sometimes comes up is like, something will be like, well, my dog's value was 0, right? Or undetectable on the baseline cortisol. Does that necessarily mean that my dog has Addison's disease? And it doesn't actually. Like I've seen plenty of times where the dog has an undetectable baseline cortisol, and you follow it up with this other test called an ACTH stim test, and that test is, and that will be perfectly normal. So you can't necessarily make any assumption based upon what you see on the baseline cortisol. But if it is less than 2, you really need to follow it up with something called an ACTH stimulation test. And what is this ACTH stimulation test? So this ACTH stimulation test is essentially a test that tells the adrenal gland to do its job, right? And so what you do is you inject an animal in their muscle or their vein with this substance called ACTH. It's a synthetic hormone. You wait an hour and then you draw the blood for cortisol again. And I'm actually just going to kind of back up because this is actually a good slide to explain to you what you're doing with this ACTH stim test. So you can see there's this substance ACTH. It acts on the adrenal gland. And what it does is it tells the adrenal gland to make cortisol. So if you give it exogenously by giving an injection in the dog, your adrenal gland should respond by increasing the amount of cortisol in the bloodstream if the adrenal gland is normal. And so that's actually what we use for testing, because what you see from when you test it in an affected patient before the test, this is what you see in an affected patient here on the left. Before you give the ACTH, you see that the cortisol is low. And after you give the ACTH, the cortisol is also low. The adrenal gland really doesn't respond. If your dog is unaffected and doesn't have Addison's disease, what you'll normally see is you'll see a baseline cortisol that's actually above this reference range. But once you give the ACTH, it will all go up into way above the reference range because the adrenal gland is responding to the cortisol. And so that's typically how we distinguish an affected versus an unaffected dog. The ACTH stim test will be flat in the affected dogs, and you'll see a rise in the cortisol in the unaffected dogs. So that's typically how we make a definitive diagnosis of Addison's disease. And typical versus atypical, if they're typical, they'll have the electrolyte changes along with the abnormal ACTH stim test. If they're atypical, excuse me, they'll just have the abnormal ACTH stim test, but their electrolytes will be normal.
Okay, can you go back to the previous slide for 1 second?
Yep.
So just to point out, which I think is clear, but I want to make sure it's clear. On the right side, there are dogs. I normally call dogs people, so I was going to say people who have the orange dots below the line. So some of those have a low baseline cortisol, those dogs, and then they stim anyway, even though it's low, which is what you were saying earlier, is that's why we can't rely on a low baseline.
That's right. And the reason for that is, some people ask me like why that's the case. The reason is because cortisol is something that fluctuates normally throughout the day based upon, what level of stress we're going through. And all of the evidence at least in people, for example, we know that cortisol spikes first thing in the morning. So, I guess none of us really like to get out of bed, and it's a stressful moment to sort of wake from our slumber and roll into the shower or grab that coffee. But so that's why cortisol tends to be high, but because it can go through these peaks and valleys throughout the day, any sort of spot measurement, unless it's above 2, we really can't say, is it normal or is it abnormal?
Okay. And I'm noticing the time, it's 1:15.
Oh, okay.
So
Yeah.
if we can do a quick run through treatment perhaps, and then save time for research and questions.
Yeah, for sure. Absolutely. Yeah. So for treatment, right? So treatment is really, we're not going to get into so much of this, but as a critical care veterinarian, like the first thing you need to do is you need to sort of treat the shock, right? Particularly for these patients who come in with typical Addison's disease. This typically requires fluid boluses. A lot of times patients will have very high potassium levels. There's other drugs that we can give to lower those potassium levels. And then sometimes when the sodium is really low, we also need to focus on how fast we replace that sodium, because large swings in sodium can have very damaging effects to the brain. So we have to kind of keep that in mind. From an ongoing perspective, we need to replace the hormones that are lost, right? That's really the fundamental treatment. And for aldosterone, for typical Addison's, we usually use Percortin or Zycortol. There may be a few of you out there who use a daily pill called Florinef, but I think most dogs do not wind up on that medication for a whole host of reasons. And then for cortisol replacement, your dog probably gets some kind of a steroid, oftentimes prednisone, at physiologic or sub-physiologic dosing. There could be a whole discussion around the doses of these drugs that we're probably not going to have here today.
Okay, so question, if you can go back for 1 second.
Sure.
One of the things about crisis treatment is it can be very expensive. And I think it's important for people to understand that part of the expense is getting them through that crisis, and that you can't just give an injection of procorticoid if the sodium is very low, that's would actually be dangerous.
Yeah, absolutely right. So that would be dangerous to do. Also, like when the potassium is really that high, as we sometimes see in these cases, they need to stay in the hospital for a couple of days to make sure that that gets to a normal range and stabilizes. And some dogs, when you're in a shock state, that can have effects on other organs as well. So it can, for example, cause poor oxygen delivery to the gut. You can have patients sort of start to slough their gut. There can be brain effects. There can be other things that we see. So sometimes these dogs need to be in the hospital for a couple of days. Sometimes maybe it's just an overnight, but it sort of just depends. Every case can be different. So.
Okay, thanks so much for talking about that.
Sure.
And yay, we get to move on to.
So this gets a little bit of the research, right? I know you wanted to talk a little bit about this. So
well, and breeds too. I love this part.
Yeah, so this is actually pretty interesting, right? So, up until we really had for a while, there was a lot of anecdotal information that we had, or sort of some smaller studies looking at the breeds that are predisposed to Addison's disease. But in 2015, this really amazing study came out of Sweden. And one of the things that, I don't know if anyone is on the call from Sweden, but one of the things that I've learned about dogs in Sweden is the vast majority of them are actually insured with pet insurance. And so that gives pet insurance companies in Sweden access to a lot of veterinary medical records. And so this researcher, Janine Hansen, and her colleagues out of a university in Sweden looked at 525,000 dogs over a relatively long period and tried to figure out which breeds were overrepresented in Addison's disease, at least, and this is based upon Swedish data, but it really should be relatively representative. And what this shows you, you see there's a list of dog breeds on the left with Portuguese water dog on the top and English setter on the bottom, and you sort of see this dashed line in the middle. And any breed that essentially where this dot and the horizontal bar doesn't cross that dashed line is considered to be statistically significantly have an elevated risk of developing Addison's disease. And what you'll sort of notice is that the #1 and #2 breeds are Portuguese water dogs and standard poodles, where Portuguese water dogs are essentially 29 times as likely as an average dog to develop Addison's disease, and standard poodles are 17 times as likely as an average dog to develop Addison's disease. And that's like way off the charts, even relative to other breeds that have a high risk of Addison's disease. And those other ones that came out as statistically significant were bearded collies, Cairn terriers, and cocker spaniels. No, well, and sometimes people were like, oh, but I see this all the time in Great Danes, or I see this all the time in Nova Scotia duck-tolling retrievers. But when you sort of look at the statistics of how common those dogs are or uncommon, at least in this Swedish population, it was really just these 5 breeds, with Portuguese water dogs and standard poodles being the poster child. And that's kind of what we're actually taught in vet school, more so the standard poodles, because it's a much more common breed that we see. But essentially, that's actually what the data shows us. Now, what's kind of even more interesting, and sorry, I babble like a lot, as someone who's a geneticist, so these are the breeds I just kind of highlighted here. So this is a complicated figure, but I'm going to kind of explain to you what it is and simplify it. So this I sort of sometimes just call like the wheel of dogdom. And what it essentially shows you, was put together by a very well-known geneticist at the National Institute of Health, Elaine Ostrander, and her colleague Heidi Parker. They use genetic data to figure out how related is one breed to another breed. And so if a dog is really close to each other, right? So here's like, I'm just gonna, if you can see my cursor, it's right over a Norwich Terrier and a Norfolk Terrier. So those breeds are really, really close to each other, right? And they're really different from a dog on the other side of this wheel, a Rhodesian Ridgeback. Now, when you look at this sort of wheel of dog relatedness, one of the really interesting things that you see is you see that standard poodles and Portuguese water dogs, where do they fall on this wheel of dog relatedness? Well, they are next of kin, right? So a standard poodle is closer to a Portuguese water dog and vice versa than any other dog breed that we know of. And so what does this suggest from a genetic basis? If these are the 2 dog breeds that essentially are highly overrepresented with Addison's disease, is it kind of suggests that the genetic causes for Addison's disease are likely to be shared among these two dog breeds. And this is part of the reason why I focus my research on these two dog breeds, is because they share a common genetic ancestry and they also have a relatively high incidence of Addison's disease. But just as another kind of aside here, right? Take a look at a breed like a bearded collie and an English Cocker Spaniel, or the Cocker Spaniels. They look to be very different from standard poodles and Portuguese water dogs. So what does that mean? Could the genetic causes of Addison's disease be the same, or are they more likely to be different because it arose from a different reason? And that's one of the things that makes this disease so interesting from a genetic perspective. You have these other breeds who don't appear to be highly related to standard poodles and Portuguese water dogs, and could they in fact have a different genetic reason, or is it the same? Like, we don't really know the answer to that question, but it begs some kind of interesting thoughts here.
So these are the slides that got me so super excited about having you come. And it's not just because I have Portuguese water dogs and standard poodles, but in our group, we have so many different breeds. I know that there are people listening who want to say, hey, what about German short-haired pointers? Yep. And what about Westies? And all the other breeds that we have. And we have a lot of them. We have bull terriers, a lot of them in Australia, and mini bull terriers. So I think what's important is any breed can get it, but you find it highly represented in certain breeds. And the fascinating thing is you're studying not just standard poodles and Portuguese water dogs, but English Cocker Spaniels.
Right, and so like English Cocker Spaniels is we study them because they're different. That's actually part of the interesting piece of the puzzle, right? Why didn't we do bearded collies? It's just sort of the way in which my research plan unfolded. There's a whole host of a little bit of some backstory to it, but it's mostly like irrelevant. The other sort of comment that I just want to make is, you mentioned there's probably people thinking, oh, what about like bull terriers in Australia? So, dogs can develop, like, let's say, for example, you have a common, a sire that's used a lot in Australia in a bull terrier, and that dog happens to have Addison's disease. Well, it can create these sort of like pockets that have a high incidence of Addison's disease in scattered places throughout the world. So keep in mind that epidemiologic data I showed you was from Sweden. It could be, if you were to look across Australia, I would still think you're going to see really high incidences of standard poodles and Portuguese water dogs, but maybe bull terriers, rise up to the top, whereas they don't in other populations. So there's good evidence of, this inbreeding that we see, because that's how dog breeds were made, causing these sort of like localized populations that, are interesting to study. But to some extent, there's also only so much bandwidth that one person has. So,
right.
Yeah.
Okay, I'm going to let you just go on at your own pace.
So I think well, let me just sort of say, let me just make a suggestion. So I could either babble about research for 10 or 15 minutes, or I can give like a very high level overview of some of the research stuff, and we can take some more time for questions. What do you think would be like, talk 5 minutes about the research and spend some more time on questions? What do you think would be better?
I think perhaps 5 minutes on research, but one of the things that I guess we want to get out of this is we have a lot of breeders who will want to know, what do I do?
Okay,
that sort of thing. So breeding questions.
Okay, so
and the other piece, remember we talked about sort of the three-pronged cause.
Yep. So that's what I was gonna, I'll get into that. And if I don't, like,
Right.
ask me the question. So let me sort of go through I'm gonna sort of spend some time like a high level research plan and just tell you guys a little bit about what I'm doing without really getting into the details. So I have like a couple of really important goals with my research program. And so far and away, like, this is really the reason why I got into this, is to be able to try to predict what dogs are going to develop Addison's disease. I know that's what breeders want to know the answer to this question, but certainly, and how to breed away from Addison's disease is a whole nother ball of wax. But one of the first things we need to do is be able to say, can we actually figure out which dogs are going to get this before they get this? The other thing which I really want to do is, if we can figure out which dogs are going to get this, can we then develop ways of actually preventing and treating Addison's disease, right? And to some extent, this is a little bit like very futuristic and future oriented, right? You can sort of think of a common autoimmune disease in people like type 1 diabetes. There's still no way of preventing it, or sort of a novel way of really these immunologic therapies to treat those diseases. But in the future, I'd love to be able to sort of say, okay, this dog is going to get Addison's disease. Now we can sort of give this dog some, essentially like a vaccine will teach its immune system to not kill the adrenal gland, so it can kind of go on and live a normal life, right? So to develop these new ways is really something I'd love to be able to do, but that really hinges on being able to predict which dogs are going to get the disease. And then finally, and this is something Lori and I have discussed before, and I think it's really important for people to understand, is that we are highly unlikely to ever be able to predict, just based upon genetics, which dogs are going to develop Addison's disease. So one thing which my research has shown with 100% certainty is this is not a simple autosomal recessive trait where you're going to get, my dog has it, my dog doesn't, my dog is a carrier, and by breeding in this way, we can get rid of it. So Addison's disease is likely to be a complex trait, meaning there's lots of different genes that are involved in the development of the disease. But on top of the genetic predisposition, there is likely to be some kind of an environmental trigger that actually puts a dog that might be predisposed over the edge. And this is sort of the prevailing theory of the way that all autoimmune diseases happen. What are those environmental triggers? Are they common? Are they different in every animal? We think about environmental triggers. We think about, could they be drugged? Could they be environmental toxins they're exposed to? Could it be something in a vaccine? I sort of hate to say that because I don't want anyone to sort of perceive me as like an anti-vaxxer. Please, vaccinate your dogs. It's really important. But we need to understand, what is it, a medication? Is it a flea and tick product? Is it, some sort of toxin in the environment? Is it an antibiotic? Is it what is it that actually puts a dog over the edge and helps them develop that lead to Addison's disease? So I want to try to understand all of these things. And the way that we're kind of approaching this is we're approaching this from a genetics perspective, an immunology perspective, and an environmental perspective. And fundamentally, I'll just sort of talk at a very high level. From a genetics perspective, what we do with this is we look at the DNA of dogs. We sort of interrogate it and look for markers that are born at the level of birth that are going to predict whether or not a dog, or tell you something about the risk of a dog developing Addison's disease. From an immunology perspective, we have another study going on where we're sort of looking for a signal that the immune system is sending us that it's about to attack its own adrenal gland, right? So these days, when we think about COVID and these other things in the news, the big thing that we often think about is once you do get your vaccine is how high are my antibody levels, right? What are my antibody levels? Well, when the body attacks its own adrenal gland, it will also develop antibodies against the adrenal gland. So we're trying to identify these immunologic markers that could predict the onset of Addison's disease. And then finally, from an environmental perspective, we actually just have a survey that I'm sure many of you guys filled out. We probably have about over 5,000 respondents across the world, which is great. Mix of dogs mostly without, but also about 300 or 400 with Addison's disease, to try to understand what's different in the environment, what dogs are exposed to that might differ between dogs with and without Addison's disease. So that's another thing that we're trying to get at. And this environmental piece is really very, very challenging. It's very poorly understood for even most human autoimmune diseases. I think, for example, the one thing that's known in people that's clearly an autoimmune disease trigger is cigarette smoking, because it can sort of cause changes to proteins. But that's really not something that dogs are very, very commonly exposed to, although certainly one of those things that we're looking at in terms of secondhand smoke and Addison's disease and things like that. So that's kind of the generic approach to this. That's sort of the five-second overview of kind of where we are. I hope that gives you a brief sense of what I'm working on, and I'm happy to talk about more of it as well. So get through the questions.
Okay, thank you. Like I said, we could have talked about this for 10 hours.
Yeah,
so if I understand what you're saying is sort of what contributes to Addison's developing is there needs to be a genetic predisposition.
Yep.
And an autoimmune event in which the autoimmune system attacks the adrenal glands. And there can also be environmental triggers,
Exactly.
either inside or outside of the dog, I imagine.
That's right. Yeah, absolutely. So I think the best model, right, that we sort of have of this is there's a genetic predisposition, and how much of the predisposition is genetic, we don't know. It could be that 80% of it is genetic. It could be that 40% of it is genetic. Like we really don't know the difference between the contribution of the genes versus the contribution of the environment. But something in a predisposed animal will trigger the immune system to start attacking the adrenal gland. And then we can start to see these markers like these autoantibodies develop, these other cells in the body which start to destroy the adrenal gland. The genetics of the environment will trigger that autoimmune response, if that makes sense.
Okay. And so you mentioned vaccines, and we already have a question in the chat, and we also get a lot of questions in the group. Can you clarify that vaccines in and of themselves don't cause Addison?
Yeah, I mean, and they're to the best of any research, anyone's knowledge or anyone's research out there, they don't. But you know, you hear anecdotes all the time as my dog was fine until he got such and such a vaccine, right? So you know, but the data doesn't support that it exists, and it, you know, there's a big difference in science between correlation, right? Something just happened at the same time, and actually proving causation. And I think, you know, they're very, very different things. And to sort of think about causation, we really have to rely on more rigorous epidemiologic studies that suggest something like that. And the reality is that we just don't know the answer to that question.
Okay. And sometimes what happens, what we see is that the adrenal glands are failing, and any stressor on the body can sort of reveal that, oh, I don't have the adrenal response to cover this stressor, which could be a vaccine. It could be any number of things.
Totally, that's right. You know, if you think about it, you know, if you have your sort of, you know, your body's destroying its own adrenal gland, the dog's adrenal glands, the dog hasn't presented with very strong clinical signs, and you take them to the vet to get vaccinated, which is a super stressful event, and then they come down with Addison's disease. Well, was it the vaccine, or was it more likely that just the stressful event actually just revealed an underlying disease process because the dog was stressed from the visit to the vet? You know, that's probably the more likely scenario. But in the reality, we just don't know the specific environmental triggers at this point.
And one of the questions is there a time frame for how long it takes for the adrenal glands to fail enough to be diagnosed with Addison's? Can it happen slowly for some dogs and quickly for others?
It's a great question. And so, you know, there's no definitive answer to this, but I can sort of say a couple of things. So at least in standard poodles and Portuguese water dogs, they tend to get the disease when they're young. So about 1 to 3, 1 to 4 years of age. So that would suggest that there is some slowish kind of destruction that probably happens from when a dog reaches maturity of about a year to whenever they develop Addison's disease. It's probably not, you know, a 10-year process in which the gland is destroyed. The other thing that is true of almost any disease, whether it's kidney disease or whether it's Addison's disease, is in order to see clinical signs, we typically think of about 70 to 75% of an organ has to actually be destroyed before you see clinical signs. So if a dog has 50% of its adrenal glands functioning, we're never going to know it, and the dog might be perfectly normal. And so that's when it really becomes really hard to figure out clinically, because there are no clinical signs. There might be, for example, autoantibodies that develop, in which case we might be able to sort of know that it's happening earlier, but you know, that's typically how I would think about this. And in terms of progression, you know, the one bit of evidence that we do have that there is some progression of the disease is when you have these atypical dogs that become typical dogs. So what we sort of, the assumption is that the immune system starts out by destroying some of the cells in the adrenal cortex that make cortisol, but eventually the autoimmune reaction spreads and starts to kill the other cells that make aldosterone, but certainly doesn't happen in every case. Dogs that are atypical can sometimes stay atypical for the rest of their lives. And, why that happens, we just don't know.
And we see a lot of dogs who stay atypical. I suppose there's no numbers or statistics on how many will transition.
Not that I know of, not that I'm aware of. Yeah.
Okay. Some folks are asking about personality in terms of how much does the personality and things like chronic or acute stress, how does that play into whether they'll be diagnosed or not?
That's like, it's something I hear about a lot, when I sort of talk to people, but it's nothing that's ever been researched. So I can't really answer that question. Is it because the dog is sort of lacking in hormones that they sort of are this stress type of personality, or is it, are they exactly how related they are? I don't really know, but it would be a really interesting thing to study. I think part of it is like, it's very hard to sort of scientifically quantify, personality, especially in a dog, and to study it from that perspective. But it's something you hear about anecdotally, and I wouldn't dismiss it, that it's true, it's just maybe not something that a scientist can really prove. So.
All right, moving along, trying to fit in as many questions as possible. Sharon, if you're there, Sharon's question was, is there a link that you know of between Addison's and IMHA, immune-mediated hemolytic anemia? Or in other words, do many dogs with Addison's develop IMHA?
No, great. That's a great question. And so the answer to that question is not that I know of, or not that anyone has studied specifically, but we do sometimes see dogs that develop multiple autoimmune diseases. Like, that is something that's clearly documented in the literature. I wouldn't say it's common. It's not happened in most cases, but for example, maybe more commonly than seeing dogs with IMHA and Addison's disease, you could see a dog that has both Addison's disease and hypothyroidism, right? Or Addison's disease and type 1 diabetes. So those more endocrine oriented autoimmune diseases, those can definitely occur together. It's rare that it happens, but we do see those. I certainly have seen cases of Addison's and IMHA as well, but there's been no study that's shown that it's like overrepresented. The other thing is, but although the two other things I would sort of say is that the way the immune system attacks itself in Addison's and IMHA is very different. And so I would probably doubt that those two diseases have a strong link, but there are certain genes, and they're called major histocompatibility complex genes, that do underlie almost every autoimmune disease. And so that's probably why some dogs with one autoimmune disease will develop multiple. It just, Addison's and IMHA don't go together that commonly.
Okay. And we see a lot of some other diseases like IBD, irritable bowel,
Sure.
Things like that. And basically the same answer, right?
Same answer. I would give the same answer. Yep, for sure.
Right.
IBD is one of those things that is like tricky because it's, it really requires a very not invasive, but you have to sort of look at mucosal biopsies or full thickness biopsies to really make the diagnosis. So it can be challenged. Is it IBD that was just diagnosed because a dog responded to a different food, or was it sort of like clinically, unequivocally histopathologically diagnosed as IBD? So.
Okay, so this question is about if you have Addison's. So Sonia has a dog named Sky who has DCM.
Okay, yep.
Heart disease. And she wants to, and it's not getting better. This is not grain-free food related at all. She says it's not getting better. Is there would the Addison's affect the progression of DCM or other diseases?
So DCM, so I'll just sort of, for everyone's sake, so DCM is a disease called dilated cardiomyopathy. It's a disease of the muscles of the heart. You can see it in any breed, but it's most commonly presents in Great Danes and Doberman Pinschers, with younger Great Danes and older Doberman Pinschers. I'm not sure if that affects your dog. To not get better from DCM is common, unfortunately, because DCM is like a progressive disease that is genuinely like life-limiting, unfortunately, for dogs that get it. Could there be a relationship between having Addison's disease and not getting better from DCM? It's possible. I just don't know that anyone's really ever studied that particular link. Certainly giving steroids at too high of a dose can worsen heart disease. It's possible that steroids at too low of a dose could impact DCM as well. So I just think it's one of those things that we don't really know the answer to, unfortunately. If I were to research it, I would probably first look at the human literature and see if patients with cardiomyopathies and Addison's disease have worse outcomes, because it's just more likely to have been studied in humans than it would be in dogs. But it's a great question. I just unfortunately don't have the answer.
And is there any evidence that their dogs with Addison's are more prone to developing cancers or any other disease?
Not that I know of at all. No.
Right.
Lori, your microphone's going funny again.
Okay. You talked about prednisone.
Yep.
If you can understand me well, it can both help dogs with stress, but our experience is that too much can make them anxious and hyper. Does that make sense?
Totally. So it definitely makes sense. Steroids in doses that are high can cause lots of problems, ranging from stress to too much eating, too much peeing, too much drinking, right? All of those things, weakened immune system can happen, and that's really the trick of Addison's disease, right? So, and this is part of the reason why it can be bad, is because no matter how hard we try, right? Whatever dose you come up with for your dog, you can never do as good a job as the adrenal gland could itself at regulating exactly how much stress hormone your body needs, right? Or the dog's body needs in this case, because that's what it's designed to do. It's designed to give out exactly how much stress hormone you need at a particular time. So if you're giving the same dose, whether it's too low or too high, there are going to be times at which whatever dose you're giving is either too high or too low. So you can never be perfect. And that's one of the sort of rubs of Addison's disease. One of the things that people are looking at is, can we, and you've probably heard of people trying to create an artificial pancreas, right, for patients with type 1 diabetes. There are people looking at creating an artificial adrenal gland for people with Addison's disease that can do the same thing, that can sort of respond to the need for these hormones a little bit better than we can with whatever we give. And so it's hard, right? Because at too high a doses, steroids can have problems. And certainly at too low a doses of steroids, dogs can have problems. And it's just, it's unfortunately part and parcel of having this disease, is finding what's most commonly most appropriate for your particular animal.
Okay, that's very easy to understand. And what we find, which makes it more confusing, is sometimes too much and too little can have the same effect. Just to make it extra confusing.
For sure.
I did promise that we would end at 1:15, so I want to keep that promise. I just want to thank you so much. You have been extremely generous with your time, both today and leading up to this, and we appreciate it very much. And we need to know how we can help. So I know the environmental survey is out there.
Yep.
And if there's any other ways that we can help, we'd be happy to do that.
Yeah, thank you guys. I really appreciate it. I think, for any of you guys who want to sort of follow up, especially if you do have a poodle, a standard poodle, a Portuguese water dog, or an English Cocker Spaniel, and haven't yet participated in either the survey or any of the other studies we have going on, please reach out to me. I think Lori's probably posted my contact information. We could get you enrolled in any of the studies you want to participate in. And again, if there are Lori, if there wind up being a gazillion and one questions, and you feel like you want to do something like this again at some point in the future to talk either more about the research or just have more of an open Q&A question, I'm happy to do it. I sort of fear a little bit that many of the questions there won't be definitive answers to, as is so many things in veterinary medicine. But you know, it's a little bit of like slow progress to try to get there. You know, I do think that being able to predict which dogs are going to develop Addison's disease will be a game changer, and hopefully, you know, we'll get there. And that's like one of the main things that I'm working on. So
Yeah, and that would be amazing.
Yeah.
So I am not going to make you commit to doing more of these, but I may shoot you a question every now and then if I can't answer it. But if so, for now, if you would like to make me host,
Okay,
you
yeah.
can go on with your day. Oh, and also stop the recording.